Hello, my name is Mark MacBayne. I'm the practice administrator for hematology, oncology, and adult bone marrow transplant at UCSF Medical Center. I'm here today to talk about how to become a brain surgeon. A brain surgeon is a physician who specializes in surgery on the brain. The first step in becoming a physician is to complete an undergraduate course of study at a four-year college or university. Typically, one interested in going to medical school will major in a science, such as biology. However, this is not required. If you do not major in a science, however, you will need to make sure that you complete all of the science prerequisites for medical school, that being at least 2 years of biological sciences, chemistry, physics, and calculus. Medical school is highly competitive, and in order to be a viable applicant for medical school, you will need to keep your GPA at or above 3.7 during your undergraduate career. You will also need to take what's known as the MCAT, or the Medical College Admissions Test. This is a standardized exam that all med school applicants must complete. Medical schools use your MCAT scores along with your GPA to evaluate your viability as a medical school student. Once you've started medical school, you've committed to an additional 4-year course of study. The first 2 years are typically reserved for didactic instruction in the health sciences, and the second 2 years are typically reserved for clinical instruction, that is, learning clinical skills of being a physician. Upon completing medical school, you become a medical doctor. However, you're not quite ready for brain surgery. First, you must complete a residency in a surgical program, particularly, in this case, in neurosurgery. Neurosurgery is one of the few specialties that does not employ necessarily the match system. So you would need to apply to teaching hospitals that have a neurosurgery residency program. This is a minimum of an additional 8-year course of study beyond your medical school education. And during these 8 years, you learn first the skills of a surgeon, and second, the skills of a brain surgeon. Upon completion of your residency in neurosurgery, you can opt to go on and do additional formal studies during a fellowship. Upon completing all of your formal postgraduate training, you can take the board exam and become a practicing neurosurgeon. This is Mark MacBayne, practice administrator for hematology, oncology, and bone marrow transplant at UCSF Medical Center.